One thing that I was definitely wanting to talk about at some point or another, and why not now? It's as good as time as any, is nursing aversion. During pregnancy, I continued to breastfeed, obviously. While I was pregnant, I found out that I was pregnant, expecting with Isley when Watson was 17 months old. So, it was up in the air. I wasn't sure. I'd heard that some babies wean during pregnancy because a lot of times your milk will dry up or the taste will change. And then I had heard that some babies will continue to nurse. So I was okay with either way that it went. I was just basically playing it by ear. He, of course, is a diehard breastfeeder, so he continued to nurse throughout pregnancy. But I suffered with terrible nursing aversion, and for those that don't know what nursing aversion is, it is a hormone shift while you are nursing. And of course pregnancy can cause it, but it makes you feel just like you can't sit there anymore, like you can't stand nursing while you're nursing. Like sometimes I would even feel like I just wanted to like yank him off of me and sit him down really hard, you know. It was a horrible feeling to cope with. You feel like your body's rejecting, not something that you're meaning to feel or that you want to feel like. You want to feel nurturing to your children. You want to feel like, especially at 17 months, because my goal is always 2 years, because their immune system is not functioning near where it's supposed to be at 1 year. So I know a lot of people's goal is 1 year, and I encourage people who aren't sure what type of breastfeeding goal they want to set to really try to aim for 2 years, because at 1 year a baby's immune system is only functioning at about 30% of what it should, and then by 2 years it's closer to 80%. So any sickness that you'll encounter, just immediately your milk starts tailoring to passing antibodies on to your child even before it's fighting it and giving antibodies to yourself, your own body. So there's so many reasons why breast milk is amazing, but I reached out to my local La Leche League. They're amazing. I've gone to them with several issues, many of which I want to do a video of or about eventually, but this was one of them. So I had to set limits. That was definitely one thing that I had to do for my sanity. At the beginning, he was to the point in age where I could limit the amount of time that he was on the breast. So I started off with 5 minutes. I would limit his nursing sessions to just 5 minutes, and I would set a timer on my phone. And he got highly upset the first few times, but he got to where he understood, and you know, he got used to it, so it didn't bother him as much. Then it got worse for me. My nursing aversion really peaked when my milk started to dry up. For anybody who's ever dry nursed a baby, it is not pleasant. There's no milk there. So it's like, it's an undescribable feeling. It's like somebody trying with like a cat, you know how they have like a sandpaper tongue, like a cat trying to suck on your breast and there's no milk coming out. It's very uncomfortable. So I had to cut back my time limit to 2 minutes at that point. And then when my colostrum came back in, which for me was around 24 to 26 weeks, then I was able to go back up to 5 minutes. Towards the end, I was even just letting him nurse as long as he wanted. It didn't bother me anymore. But one of the biggest turnaround points for me, and why I think I got to the point where I didn't have to put time limits on it anymore, was my leader's suggestion of magnesium, calcium supplements. She said sometimes your body will get, especially during pregnancy or breastfeeding, your body sometimes will get out of balance with the nutrients and vitamins and stuff that you need to maintain a normal mood, maintain normal hormone levels. So I noticed a difference when I started taking a calcium and magnesium supplement. I want to say within 2 to 4 days. And it did. It helped quite a bit. So for any mothers suffering, excuse me, with nursing aversion, or who are trying to breastfeed through pregnancy, I highly recommend trying a calcium and magnesium supplement. Of course, clear it with your doctor, but adding it into my daily routine with my prenatal vitamins made a huge difference for me.